Hi everyone, my name is Sonia Gordillo and I am one of the pre-health advisors at the University of Oregon. We're located in the College of Arts and Sciences Advising in Tykeson Hall. Today we're going to do a workshop on academic comebacks, GPA improvement options for health careers. So if you are a pre-medical student, pre-physician assistant, pre-dent, or any of the other allied health careers, and you are either concerned about your GPA and how that will look like in the eyes of admission committees, or you would like to learn more about what it means to be academically competitive, stay tuned because we'll have some information here for you. All right, so today's agenda, we're going to go over academic readiness and academic competitiveness. With that, we'll talk about holistic review, we'll bring in some data, and then we'll talk about some options for you to build your academic competitiveness. We'll talk about what option is going to be a good option for you. And then that will conclude our workshop. All right, so to get us grounded before we tap into all of those things, I wanted to go over some definitions here. So anytime I'm saying baccalaureate, I'm referring to your bachelor's degree. You are currently at the University of Oregon completing your undergraduate years. You are in the process of completing your baccalaureate degree. So when I'm mentioning baccalaureate GPA, that is your undergraduate GPA. Post-baccalaureate, that is courses taken anytime after completing your bachelor's degree. So if you took a random history course at your local community college post-graduation, that is going to be post-bac coursework. Then we have cumulative undergraduate GPA, or the other term that you'll hear is overall cumulative GPA. That is referring to your GPA that brings both your undergraduate GPA, so baccalaureate GPA, and your post-baccalaureate GPA together. So overall cumulative. Then we have graduate GPA, so that is referring to any graduate level coursework. And then your science GPA, so that is bringing in all of the biology, chemistry, physics, and sometimes mathematics courses all together to bring that science GPA. So BCP or BCPM is typically the terminology used there. BCPM is only used for medical schools typically. For all other health-related graduate programs, they typically just calculate the BCP, biology, chemistry, physics, which is different from your prerequisite GPA. So prerequisite GPA takes the GPA for all of the specific classes that are required for admissions for a specific program. All right, so minimum requirements versus holistic review. So when you apply to a health-related graduate program, you're going to submit your application. They are going to receive it. From there, they're going to screen you for minimum qualifications. If you meet those screening requirements, they're going to review your application. That is where holistic review comes into place. They like you, they'll interview you, and then they'll bring all those pieces together for another holistic review and make a final decision. In order to pass the screening process, you need a minimum of a 3.0 cumulative GPA. In addition to that, they might also require a minimum standardized exam score. So for example, for medical school applicants, that is typically a 500 minimum MCAT. For other health-related graduate programs, you'll need to look at their website and see what specific minimum requirement they have for their standardized exam because it can vary program to program. All right. So holistic review. So holistic review is when they bring all of the pieces of your application together. So not just academic metrics, but also take into consideration your experiences, both from professional and life experiences, and all of the attributes and qualities that you're highlighting of yourself in your application. So they'll bring that together to determine your fit for their program. All right, so when they do a deep dive of your academics to determine your academic competitiveness, they're going to be looking at a variety of different things. So of course, they're going to look at your cumulative GPA. Of course, they're going to look at your science GPA. They may also look at that prerequisite GPA, and then they'll take a look to see if there were any repeat courses, particularly for prerequisite classes or science classes, and see how well you did in that second attempt. If you had to use pass, no pass, or do a withdraw in a course, are there any trends of that in your application, or was it a one-time thing? If it was a pass, no pass, or withdraw for a prerequisite course, did you reattempt it, and how well did you do in that second attempt? And then with that, they'll take a look at any trends in your transcript. So overall, what is the story that your transcript is telling them? Any upward trend, downward trends? Was there a year that things just didn't go so well, but you really turned it around? They'll want to get a feel for that. And maybe they'll see, okay, in that second year, they didn't do so well. And I'm looking over here in this other part of their written application, and I can see there was some life stuff going on. So they'll start to connect the dots there. But they'll take a look at these academic pieces in combination with your standardized exam score. So in the scenario that you didn't do well in organic chemistry, they may look at that chemistry, organic chemistry section of that standardized exam to see if you did better. If there was a continuous trend of not doing better, that may not look so good in your application. So also keep that in mind. All right, so here is an example of what schools will be looking at when they're looking at your academics. Of course, they're going to look at your official transcript that will also be sent to programs as well, but you're going to be applying through the centralized application system. And so that application system brings all of your academic metrics together into a nice tidy form like this. So this is pulled from the AAMC. So this is for a medical school applicant, particularly MD programs. And then for DO and other health related graduate programs, it very much looks like this. Format is slightly different, but all of the same pieces and information is there. All right, so for this candidate, you can see on the left-hand side in the status section, you'll see high school freshman, so on there. And then highlighted, we have that post-baccalaureate undergraduate GPA, cumulative undergraduate, so that's bringing it all together for both undergrad GPA and post-bac. Then we have that graduate GPA. We have up at the top that's highlighted in blue, we have BCPM, biology, chemistry, physics, mathematics. So that is that science GPA broken down by year. We have non-science, that's what AO stands for. And then we have the total cumulative broken down by year on that right-hand side. So you can see that this candidate started off with a 3.0 science GPA, but a 3.5 cumulative in that freshman year. Things went down the years following, and then they did some post-bac coursework. So they did about 18 credits of post-bac coursework for a total of a 314 cumulative GPA for post-bac. And then their overall cumulative between undergrad and post-bac was a 286. Then they did a graduate program. It looks like they have about 2 credits of science coursework at a 4.0, and then 16 credits of non-science at a 3.95. So a 396 total for that graduate GPA. And then you can see in that bottom section that they took the MCAT 4 times, 2017, twice in 2019, and then that last time there was a little bit of a gap there, and then they took it in 2021. You'll see that they hit that 500 score in that last attempt, and then their numbers for the different sections was ranging on average a 124 with a stronger section in that behavioral science section. So I just wanted you to see what this is looking like on their end when they're looking at your academic metrics. Here is another example. So you can see here this candidate didn't have any post-bac coursework. So that senior year, it looks like they got a 3.86 cumulative GPA. Things were on the lower end in those first few years, 3.12, 3.17, 3.10, and then things changed. Something happened in that last year. And then they went off and did a graduate program. It looks like between science and non-science credits, that was about even. They did 15 credits of science coursework at a 4.0 and 12 credits of non-science at a 4.0. So that's looking really great. Um, so there is that. So let's talk about the some data. So this data is pulled from the 2025 admissions cycle. So this is particularly for allopathic medicine applicants, MD school. And in this cycle, there was 108 applicants and 42 students were admitted. So of those 108 applicants, their overall cumulative GPA was averaging a 3.65, but for those that were admitted, it was at a 3.75. And then for those that did any post-bac coursework, their admit GPA was at a 3.80. That overall range looks interesting as well. So we have for all 108 applicants, we have a 2.69 was the minimum GPA for an applicant, and it ranged up to a 4.0. But for those that were admitted, it ranged from a 3.28 to a 4.0. So you can see that the numbers look very similar for that science GPA. And then for the MCAT, not much of a difference between all applicants versus admits, a 5.08 for all and a 5.10 for admits. All right. For DO, if you're thinking about osteopathic medical school, you can see here that for the 30 U of O applicants in the 2025 application cycle, 21 students were admitted, and then they average a 3.55 for their overall cumulative. Those that did have any post-bac coursework, a 3.33, and then similar range to MD was a 3.28 to a 4.0. Okay, so that 3.2 range kind of feels like that minimum expectation there for MD and DO applicants. You can see there that science GPA data if you're interested in looking at that. And then the MCAT is a little bit different in comparison to MD applicants, averaging about a 5.07 for those that are admitted. All right, here's some information about physician associate. So we have about 63 U of O applicants that applied in the 2025 application cycle and 20 were admitted. Average baccalaureate GPA was a 3.6. Those that did post-bac coursework, it was a 3.8. So that's pretty high for those that were admitted and did post-bac coursework. And then we have overall cumulative. So between post-bac and undergrad, bringing that all together, the overall GPA there was a 3.61. The range, so it ranged from a 3.14 to a 3.96. So that 3.14, I wonder if that applicant had post-bac coursework. And if so, were they in that 3.82 range? Something to look into. All right. And then if you're interested in that science GPA information, that is there for you as well. Okay, so all that information about data that was provided to you not to scare you, but to kind of help ground our conversation for any sort of post-bac planning that may need to happen. So with that, we're going to transition and talk about post-bac options. We're going to talk about undergraduate post-bac options and then graduate post-bac options. So for undergraduate post-bac, we have structured and unstructured post-bac programs. When you're researching programs, you're going to see terminology such as career changer or record enhancer programs. We are specifically looking at record enhancer programs. So if you're looking at a website and it says only career changer post-bac, you're going to want to skip that and move on to the next program. All right, so for these record enhancer programs, if you're looking at a structured post-bac program, this means that it is a highly defined, generally inflexible curriculum. You are applying to participate in this cohort-based program. So you're being admitted with other post-bac students and participating in same or very similar curriculum together. There might be a little bit of variation there depending on the elective options for the program and how they set up the curriculum. Um, in order to apply to the structured postbaccs, they do have minimum benchmarks. So GPA, generally 3.0, it could be a little bit higher. I've seen like a 310 or a 320. So just keep that in mind. You're going to want to look at the admissions requirements. And then there are also unstructured post-bacc options. So this is kind of like your DIY version of a post-bacc. So it is a very flexible program. You can start and end the program at any point. You may or may not be able to get a certificate or a second bachelor's degree as part of that program. For structured post-bacc, typically you are gaining a second bachelor's or a certificate, but unstructured, it kind of varies. And then GPA expectations to be able to matriculate into these types of post-baccs, they are generally lower. So it could be like a 2.0 minimum GPA, it could be a 2.5, sometimes a 3.0, but it gives you more flexibility there. And so the admissions process is less competitive. Excuse me. All right. So when you're looking at these post-bac programs, it's really important that you're looking at the resources that are available within that program or within that university. Okay. So for structured post-bac programs, do they include pre-health advising as part of that program? And if so, what does that pre-health advising look like? Is it application support? Do you have access to them even after you graduate? Is there interview prep support? Is there a committee letter associated as part of participating in the program? And if so, what do you need to get a strong committee letter? Is there any sort of like GPA expectations or letter of rec expectations for that committee letter? You can check to see if there's any sort of linkage as part of that program, which is referring to any sort of partnership that they have with any medical programs or other health-related graduate programs. If they do have a linkage, typically it's like guaranteed interview or guaranteed admissions if you meet certain benchmarks. So typically like certain standardized exam score or GPA by participating in that post-bac program. Do they have any connections to shadowing or direct patient care experience opportunities? That could be another thing that you're looking for. So keep that in mind as you're exploring these programs. Even when you're exploring unstructured post-bac programs, there is a good chance that these resources are available at that university. It may not be as centralized. Sometimes it is. But you can do a deep dive and ask that university, what does pre-health advising look like at this institution? Is there application prep support, interview support, any sort of like standardized prep support? And really get a feel for those resources available there. Okay, so the University of Oregon is an example of an unstructured postbac. So you need a 2.0 cumulative GPA and a first bachelor's in order to be eligible to apply. You typically write like a personal statement and there's a fee associated with the application. And then one of the benefits of being a post-bac student is that you get priority registration. There's this other option called community education program, which means that anybody in the community can sign up to 8 credits at a time. Of taking classes here. The downside, though, is that you do not get priority registration. You are the very last to register. So if you're trying to take classes in these upper division sciences that typically fill up quickly, then doing the post-bac might be a better option there. All right, so for an unstructured program, these types of programs give you the flexibility, as I mentioned, to start and end the program at any point. It gives you the flexibility of deciding what specific classes you would want or need to take in order to demonstrate that you can be academically competitive for health-related graduate programs. So that could be a combination of repeating a lower division sequence that maybe you didn't do so well in combination with some upper division sciences that you haven't yet taken. Or maybe you're just focusing on upper division science coursework that you haven't yet taken, or focusing, like maybe you did a biology degree for your first degree and now you want to do a human physiology degree. That could also be another option. So there's some flexibility there. Of course, you have access to pre-health advising as a post-bac student, so you're welcome to be meeting with us to talk about what your academic plan can look like to demonstrate that academic competitiveness. All right. All right, so that was post-bac program, so structured and unstructured. Those were all undergraduate level options. Then we have master's programs. So these are other options that you could pursue to demonstrate your academic competitiveness. They're typically 1 to 2 year programs. I would encourage you to explore science intensive programs. So things like biomedical sciences, a master's in integrative medicine and health sciences, or kind of like any sort of master's in biology, neuroscience, human physiology. Um, what I generally encourage you to steer away from would be a master's in public health. I think master's in public health programs are great, um, but in regards to the curriculum, how much science coursework are you going to be doing as part of that program? So if your goal is to demonstrate your academic competitiveness for these very science intensive programs, you're going to want a master's program that is going to be science intensive. If you're going to do a master's in public health or something related to that, that doesn't have a whole lot of science, it's going to be difficult for you to demonstrate that academic competitiveness. So for the most part, I would say you might want to steer away from that. I think there's some exceptions to that. I think MPH programs are a really great fit for students and their career interests, especially related to medicine. So there's been situations where I've worked with students and it did seem like a good fit, but we want to be careful with that. We kind of want to talk through the implications of what that might mean in the eyes of an admissions committee. Okay, so there's some examples here of master's programs. You're welcome to take a look at these, but I would encourage you to do like a general Google search of master programs, kind of start to read through the curriculum and get a feel for what you're going to be gaining out of that program in terms of the classes and kind of like the focus of the program. Are you going to be doing a thesis? Are you going to be doing some sort of like research project? Is it more community oriented? For example, in the Yale's Master of Science in Personalized Medicine and Applied Engineering, this program um, gives you the opportunity to be in a healthcare setting because you are observing surgeons and how they work to analyze what devices they use in their everyday work and how to enhance that. So you get some really great healthcare exposure by participating in that program, in addition to that science-intensive curriculum. In comparison, the Masters of Science in Biomedical Sciences, that curriculum might be a little bit more focused on like human physiology related classes and biomedical sciences. There might be some elective courses in there. So you want to start to compare and contrast those programs and see what's going to be a good fit. All right. Another master level option would be an SMP program, so special master's programs. These are designed particularly for pre-medical students. They are typically 1 to 2 year programs, and the curriculum is set up for you to be taking courses alongside that first year of medical school students, so that M1 curriculum. So, of course, if you do well in SMP programs, you can significantly increase your chances of matriculating into medical school. But if you don't do well in an SMP program, then that's going to significantly impact your chances for admission. So these are really great options. There may be some sort of like research project associated with the program. So again, just take a deep dive into that curriculum and see if it's going to be a good fit. Take a look at the resources available and integrated within that program. Is that meeting your need? If your need is to have, let's say, some tutoring support, be asking very specific questions of what does tutoring look like at that institution? Is it one-on-one tutoring? Is it a resource center, et cetera? Because you want to make sure that you are filling the gaps that you need in order for you to be successful in that program. Okay. And then down at the bottom, you can see an example there, and you're welcome to take a look at that program as well. All right, so a third variable option here is underrepresented in medicine programs. So these programs are designed for BIPOC, low income, and students from rural communities. These programs are offered both at the post-baccalaureate option or at the graduate level option. So typically structured programs, like I said, Masters of Science in Biomedical Sciences or SMPs. They have really high success rates. They have a lot of great tutoring support, mentorship support within the program that helps students alongside the program and really help orient them into what the application process is and how to be a competitive applicant and what it takes to write a strong application. So it really provides that wraparound support. So here on the right-hand side are some examples of some underrepresented in medicine programs. I do want to mention that for the California Consortium Post-Bacc programs, that is different than California Post-Bacc. So those are two different things. I say that because some universities are going to have both options within their university. So like UC Davis, they have Post-Bacc program, and then they have California Consortium Post-Bacc. So that anytime you see the word consortium, that's related to underrepresented in medicine programs. The other Post-Bacc is just kind of like your standard Post-Bacc for any population. Okay, so which option is going to be a good option for you? So there are a few key questions that I would encourage you to walk yourself through. So are you meeting the minimum GPA requirements for the programs that you are looking for? If not, then you would need to continue to take undergraduate level coursework so that you meet those minimum requirements. And then from there, we'll probably need to have a conversation of, is this enough for you to apply and be competitive for the programs that you're looking at? Sometimes it might mean doing post-bac to meet those minimums in addition to doing graduate level coursework. Sometimes not. It just depends on the profession that you're looking into and the types of programs that you're looking into. Are you meeting the minimum grade requirement for prerequisites? So C or better is typically what you need for many of these prerequisites. If you're looking into nursing programs, some programs might want a B or better for those science prerequisites. So if you are not meeting those minimum, you're going to need to retake those classes so that you can meet those minimum expectations. And then from there, we can explore whether or not you want to continue to do undergraduate level coursework or pivot and do some graduate level coursework. Do you feel like repeating courses could help with standardized exam prep? Maybe you have completed all of the prerequisites you need for admissions. Maybe they are at that C or better that you need, but maybe you're not feeling confident about that organic chemistry section for that DAT exam. So we could talk about retaking that sequence before exploring graduate level options, or maybe doing just post-bac coursework, doing some repeat of lower division sequences in combination with some upper division sciences. So another variable to think about there. Another one would be, which does your health profession value more, undergraduate level coursework or graduate level coursework? So that's something that you might want to keep in mind as you're exploring your options. It might mean maybe talking to some admission representatives to get a feel for what they would value in an applicant. You could probably have an honest conversation about where you're at in your academics, and kind of describe what challenges you have been facing and get a feel for their general advice, get multiple perspectives so that you can get sort of a pulse check on a variety of programs. And then aside from academic enhancement, what gaps are you trying to fill in your application? So does the program offer research opportunities? Does it provide some healthcare exposure through some shadowing? Maybe some service learning opportunities? Maybe it's connected with some sort of community organizations in the local area. Does it have test prep support, as I mentioned before? So what gaps are you trying to fill? Maybe you didn't have the opportunity to participate in research in your undergrad and you're really interested in that, and you want to apply to programs that are research focused. It could make sense to identify programs that are going to fill that gap for you. Okay, of course, take a deep dive into that curriculum, start to compare and contrast, see what elective courses are offered at one university in comparison to the other, if there's any sort of like special tracks that you can do. I know that there's some programs that you could do like post-bac coursework and then opt into doing an additional year to get a master's degree. And so like what options are available for the curriculum and for gaining either master's or certificate degrees. Demand of the program, flexibility of the program, that could be another variable to think about. What does your life look like at that point when you're looking into these post-grad programs? Are you going to be working? Do you have other responsibilities that you need to be taking care of? Are there some online options that might be a good fit for you? But of course, make sure that you're keeping in mind that it is important that you do academically well in these post-bac years or year so that you can demonstrate academic competitiveness. So if you are looking at some flexible options, just make sure that you have all of the resources in place so that you can do well in these programs, as we don't want the trend of academic challenges to continue, of course. Location, cost of living, tuition costs, financial aid resources, scholarships, all of those variables are really important things to keep in mind. All right, master's or special master's program. So two very similar options. Curriculum could look a little bit different. Timeline of completion look very similar. It's either a 1 or 2 year program. But one of the key differences here is what career opportunities are available after completing the program. So a special master's program were designed particularly for pre-medical students to give them a pathway into matriculating into medical school. In comparison, a standard master's program in biomedical sciences or other areas such as neuroscience or whatever science topic you are interested in, that is going to open the door up for careers within that area. So I would encourage you to ask admission representative what careers you could tap into if you decide to pivot into something other than that pre-health track that you were on, or maybe you want to take another gap year or two before actually applying and matriculating. And so you want to make sure you're setting yourself up for getting some experience in that field prior to application. All right, so timeline considerations. So strategic timing, I mentioned this a little bit before, but like what are the barriers impacting your academic performance throughout your bachelor's degree, and have these things resolved? So if it was personal circumstances that were impacting it, have those issues been resolved? Can you now really focus in on your academics? Was it study strategies? Have you identified what strategies might work better for you? Are there resources in place that will help support you along the program? So making sure you're thinking about those pieces is really important. Do you want your GPA of these post-bac graduate level coursework to be part of your primary application? So keep in mind that it takes a year to apply and matriculate into a health-related graduate program. So you are gonna, like if you're wanting to apply to medical school and to start as soon as possible, right now it is May 2026, so you're going to apply in May 2026 to hopefully matriculate fall 2027. So let's say you start a post-bac program in fall 2026 and you're applying to medical school at the same time. They're not going to see those grades for those classes you're taking in your primary application because you're actively in the program as you are applying. So it might make sense for you to complete the program and then apply so you can have that academic record on your primary application. So something to keep in mind in terms of strategic timing. Another piece here is how much time do you need to prepare for any sort of standardized exams? Is that required in order to apply to these post-bac programs? When would you like to have that done, either prior to the program or after the program? What is your timeline for application? So all of these pieces need to be taken into consideration. And have you built a well-rounded application that involves healthcare exposure, service, extracurriculars? What are some areas that you would like to improve upon for those pieces of your application? Do you want to do that before you start the post-bac program or after? So just to make sure that you're going to have a very well-rounded application. And then, of course, are you willing to commit to this profession regardless of the timeline considerations? And if not, what is another parallel plan that we could look at? Or another piece here is even if you do decide to commit to pursuing this track, making sure that you do have a backup option in case things don't come into fruition. So it doesn't hurt to have that conversation. Of course, we want to work with you and guide you towards that goal that you have. But if things don't come into fruition, it's better to already have somewhat of a plan in place so that you can pivot and transition, and that shift won't feel like a huge impact to you and your life plans. So taking all of this information together, in terms of like timeline and application and gap years, we're talking about improvement years versus enhancement years. So improvement years could be the year that you're doing your post-bac year and targeting all of those weak areas in your application. And then we want to focus on your enhancement year, which is a continuation of any sort of like extracurriculars and clinical experiences, and enhance those parts of your application to really demonstrate commitment and all of these other wonderful qualities that you have. So lots of variables to consider here. So kind of bringing this all together is, what are your next steps? And that would be identifying the best option for you, or some options that would be generally ideal. And that would mean exploring some program websites, really doing a deep dive of all of those pieces on their website in terms of curriculum, costs, resources, and all of those pieces. Organize a list for yourself, okay? Keep yourself organized as you're doing this deep dive. And then keep your eye out for any sort of info sessions that might be coming up for these programs that you're interested in, because that is going to be the best way for you to learn more information about the programs. I'm not an expert on their program, so it's best for you to hear it from them, and then we can talk through the pieces as you're gathering that information. Develop a standardized exam prep plan, application timeline, and that can kind of help orient us on what this timeline is actually going to look like for you, what's going to be realistic for you. And then a couple other pieces here would be to develop that financial plan and parallel planning. All right, so this concludes the end of this presentation. If you have any questions, you can always email us at prehealthadvising@uoregon.edu. And thank you so much for listening in.